Welcome to the Center for Global Development. My name is Javier Guzman. I'm the Director of Global Health Policy and a Senior Fellow. And I welcome you to our event today. We've got a very interesting topic. Next Wednesday, the Americas will elect a new director for the Pan American Health Organization. That is a very important agency for the health of the region. And we wanted to talk a bit about the election and the candidates and the process as well as the challenges. Unfortunately, we haven't been successful in securing all the candidates. The candidates have had difficulties with agenda, with interest, and that will tell us basically that this hasn't been a very open, transparent process where the candidates can talk a bit about their priorities, the challenges, in a moment that is very important for the region. I mean, we know that, it's a new chapter. It's a chapter where COVID will not be an acute infectious pandemic, but it will be a long-term problem. And we see the problems that historically have been, affecting the countries in the region. Health financing has not been very high. There's been an underspend. Inequity has been a problem with the region. Out-of-pocket expenditure. Of course, COVID showed us, the importance of public health measures, the importance of health workers, the importance of having systems in place. And we have, a lot of new challenges, non-communicable diseases, traffic accidents. And that is going to be a very difficult job for the new director of the Pan American Health Organization. So today, I'm very pleased to say that we've got one candidate, Dr. Jarbas Barbosa. Jarbas is been nominated by Brazil. He is the Assistant Director of the Pan American Health Organization. He is on administrative leave because, he cannot be in position as part of the rules and regulations. And we also have Jimena Benavides, who will be a commentator. Jimena is a lecturer and a postdoctorate associate of political science in Yale University. And we will have a very good conversation, the three of us, to talk a bit about, on one hand, the health challenges that the region faces and the plans Dr. Barbosa has for addressing those challenges. And on the other hand, the organization itself, PAHO itself, and how, those challenges with the organization are going to be tackled if he is elected. So welcome and follow us on Twitter, on YouTube, and send us your questions. Dr. Barbosa, Dr. Benavides, very nice to have you on our platform. Welcome to CGD. So let's get started with, the first question, the first topic. As I said, the region faces a lot of challenges. I alluded to some of those in the introduction, but I want to hear from Dr. Barbosa about, first, why he wants to take this very difficult post. Like, why did he get into, this issue of global health, and, why he wants to, come to the Pan American Health Organization to be the director and, address all those challenges. I guess this is a question for you to give us a bit of the human angle. Why do you want to be, the director, and what do you bring with you? Dr. Barbosa, thank you for coming.
Good morning, Javier, Jimena, and thank you for this invitation. I want to congratulate the CGD for organizing this and other events to discuss what is happening in our region, what are the perspectives, what are the challenges that you have for the next years. I do believe that it's a very important debate. We cannot have the election of the Pan American Health Organization only for the diplomats and politicians. I think that it's very important to engage the public health community in the Americas. I think that it's very important to speak out about what we think about the priorities for the organization in order to build a strong consensus that we can come together in the next 5 years. Javier, I'm telling you that I'm a public health worker. And I'm very proud of that. I'm not a politician. I have served in many different positions in my country, so I know a national health system. from my own experience. I was the Secretary of Health of a municipality, of a state. I served as Vice Minister, Deputy Minister, Director President of the Brazilian National Health Regulatory Agency. So I know the challenges to build a national health system from my own personal experience. At the same time, this is my second time here at PAHO. The first time from 2007 to 2010, I was director of a department that had communicable diseases issues, non-communicable diseases, and information system for health. Since 2018, I am the assistant director supervising all the technical departments. So I do believe that this is a very good opportunity to respond to the challenge that we have. And as a public health, I learned that in every crisis that we have had in the last decades, these crises were also a very important opportunity to move forward. When we look to since the beginning, when the effort to eliminate smallpox in the world, create the surveillance system in the world, the initiative to eliminate polio strengthened or created many national immunization programs. Now we have all this movement since Alma Ata 4 years ago to strengthen, to have primary health care. So I think that for every crisis, public health is also having an opportunity, and I think that this will be a good opportunity. In a very humble way, but I think that I'm ready to lead the organization with the experience that I have, a concrete experience from a national health system and an international organization. With the technical background that I have, I am ready to lead the organization. And if I am honored by the countries to receive their support, I think that I will implement many important priorities in the next 5 years to respond to this situation that we have in this post-pandemic era. Thank you.
Thank you very much, Jarbas. And I'm very pleased to say that we've got a second candidate who has just joined. So Dr. Florence Duperval-Guillaume, she comes from Haiti. She used to be the Minister of Health in Haiti, and now she works in the USAID ecosystem on procurement and supply chain. So welcome, Florence. It's a pleasure to have you here. We were just wondering whether you would come up, you would come. So thank you very much for joining. I guess the first question, just to get us, get to know us a bit better, is why do you want to be the Director General? I mean, if you could give us a bit of your human angle. Jarbas just told us that he is a public health specialist, I would say, and his whole life has been dedicated to public health. Can you please tell us a bit about you, Florence, and welcome to CGT. Thanks for being with us.
Thank you very much, and good morning to everyone listening to us. I will say that after 35 years of experience, either as a clinician from the beginning, and then with 34 years working in public health, I'm a public health specialist, and I face many challenges all my journey during my career. And because of the challenges that I face when the government of Haiti chose me as a candidate, because I didn't choose myself to be a candidate for PAHO. I was almost have a quote-unquote election inside of the Ministry of Health. And they have decided to call me and to ask me if I will be in.
Sorry, Florence, we lost your audio for a bit. Can you please repeat? No, we cannot hear you.
Still nothing.
No.
Can we ask you to reconnect?
Can you please reconnect and see whether we have a better connection? Okay. While Florence reconnects, let's go back to Jarbas. Thanks for taking us through, your career and your public health experience and how you want to, use this opportunity for the new chapter for the post pandemic world. And I think it is as you said, a good opportunity to change things. So if we look into the health challenges, if we look into what exactly are the priorities, the health priorities for the Americas, and what's the role of PAHO as part of, this, as part of addressing the challenges, what would you say? What would you prioritize as a director? Like, what do you have in mind?
Thank you for this question, and I also want to congratulate Florence for her participation. I hope that she can fix the connection problem so we can have her back to this very important debate. Javier, I presented to the countries 5 strategic pillars that will guide me in PAHO. The first one is that we need to complete the pandemic control. Of course, that we have left the most acute phase of the pandemic, but the virus is still there. We still can have new variants. We still can have outbreaks in some countries. So it's very important to strengthen health surveillance, including genomic surveillance in the region, to detect a new variant when it comes out immediately. It's important to keep the vaccination and to deal with vaccine hesitancy in some countries in order to get people vaccinated, and to discuss how we can have access to the new effective antivirals that are being licensed in developed countries. I think that this is very important in order that so we can get full control of the transmission if we continue working together in the countries and within the countries to finish this pandemic. My second pillar is to implement all the lessons learned during the pandemic. We cannot use this opportunity to learn what happened, the good things, the bad things, the failures, the achievements, in order to improve the national capacity, in order to improve the health system. So I think that is important, at least, to strengthen the national capacity and preparedness to detect and respond to public health emergencies in all countries in the region. PAHO can be fundamental to support the countries to identify the gaps, the weakness, and to mobilize technical and financial resources to strengthen the national capacity. This is the only way that we will be prepared. I really don't agree with some proposals that I hear in some debates that we need to have a very strong centralized health sanitary army to send 2,000 specialists to a country. This will not work, because sometimes if you don't have capacity to detect at the beginning in one country, when the world realizes that there is a new virus, you cannot control it anymore. So the real way is to strengthen national capacity and, of course, to have a better regional and global coordination. And in our case, we need to see some specificities. In the Caribbean region, for instance, we need to deal for some capacities to be strengthened at the regional level, working with the Caribbean Public Health Agency, CARFA. The second is to strengthen regional coordination. PAHO established an external committee that is reviewing how PAHO performed during the pandemic, and I am fully committed to take all these recommendations, to start implementing them at the first day of my mandate, and to be accountable and to present to member states a plan of action for the implementation, and to present the progress every year to our governing bodies. The third lesson is the vulnerability that we have had in this region, because most of the vaccines, medicines, medical devices are imported. So we needed to strengthen the production capacity for medicines, vaccines, and medical products in Latin America and the Caribbean. We need to present projects that are strategic, that are feasible, and that are sustainable. I don't believe that the purchase the old and out of the outdated factories from other countries will be the response. I think that we need to invest in some strategic actions. The mRNA platform, for instance, that PAHO launched and selected 2 projects, one in Argentina, one in Brazil, but they will benefit all the countries in the region because there is an agreement that the vaccines will be offered through the PAHO's revolving fund. Is a very good example because mRNA vaccines can be used for a new coronavirus, can be used for a pandemic flu virus, can be used for Ebola and other threats. So I think that this is the kind of initiative that you need to bring together all the countries working in a collaborative way to strengthen the capacity. And finally, to support our countries in the global discussion about this new treaty to respond to public health emergency. I will just give you one example. If we don't change the rules, we will not have, again, equitable access. And this was, I think, that one of the main problems that we faced during the pandemic. WHO established COVAX, that is a very good mechanism to guarantee equitable access, but if we don't change the rules, and for instance, we don't split the production of vaccines between countries that are pushing the vaccines in the global mechanism, if the global mechanism needs to compete using marketing rules, will happen again what happened during this pandemic. COVAX will be a very good vehicle, but will not have the vaccines to deliver to the countries. The third pillar is to recover from the impact of the pandemic on priority health programs, returning better than we were in 2019. I think that we have already in our region many good examples of interventions, new strategies that can be scaled up very fast in order to change the game. You know, I have only one example. For each 100 people with hypertension in Latin America and the Caribbean, only 50 are aware that they have hypertension, and only 25 have their hypertension controlled. For many reasons, because they cannot have the proper diagnosis at the primary health care level, because they don't have access to medicines. We have a very good initiative called the HEARTS that has been already implemented in 22 countries, but it has a very low coverage, just 14 million people in our region. We need to scale up this. PAHO can mobilize resources to have non-communicable diseases as a very important component of primary health care in order to reduce the unacceptable, preventable deaths related to NCDs that we still have in our region. The fourth pillar is the construction of a resilient national health system based on the renewed and strengthened primary health care. I think that this is the way that I see that we can move forward. We need to strengthen the national health systems in order to have them more resilient, in order to respond better to the needs that their population have. The final pillar is about how I think to change the organization in some ways that I understand will be the second question. So I will let the 5 pillar to the second question. Thank you.
Thank you, Jarbas, for taking us through your plan and talking about, the elements related to COVID, but the elements unrelated to COVID and related to other non-communicable diseases and priorities. Jimena, do you want to provide us with, commentary and your views on what Jarbas just took us through? Over to you.
Sure, Javier. Thank you so much again for CGD for the invitation. And it's wonderful to have Dr. Revels and Dr. Glenn here in this special occasion, especially when we need more than ever dialogues about how to move forward our healthcare system in the region. So, Dr. Barbosa, I was listening to your suggestions and proposals about basically strengthening the national healthcare system of all the countries in our region, and also you were paying a lot of attention to access to medicine, but at the same time, you were mentioning that we should couple these three strategies with regional and global coordination, right? So coordination, it's something different from collaboration, and you make it clear with example of Argentina and Brazil having this agreement by which they will be distributed the production of new medicines or vaccines through PAHO, right? So that's an exemplary example of collaboration. But coordination, with the pandemic, we have observed that to some extent, coordination coming from intellectual property international rules in the 90s has also led us to the problem we have been facing with COVID, which is only part of the world have been having open access to COVID-19 vaccines, right? Whereas the rest of the world was relying basically on donations. COVAX was a great strategy, but again, we were failing, and we have been, the production of the vaccines were very much controlled by big pharma of some countries, and of course, some nationalist strategies of other wealthy countries. So to what extent, and this is my question, to what extent, Dr. Barbosa, do you think regional and global coordination is needed, and how? How do you envision the kind of coordination so we don't, go all over these kind of threats that we have been already experimenting with the pandemic?
No, thank you for this very important question. I fully agree that we need at the same time to strengthen national capacity in each country in the world, but we need to review, we need to think how we can provide a better global and regional coordination. There is a lot of debate now, and I think that's important. For instance, how we can fund the WHO properly, because it's totally impossible to have a global response or to have the support for the countries before a public health emergency and during a public health emergency if we don't have at the global level WHO and at the regional level PAHO well funded with the capacity to provide technical cooperation to mobilize financial and technical resources to support the countries. Second, we know that this is a very complex discussion about the sovereignty of each country and the accountability to the other countries, to the global level when we have a public health emergency of international concern. The countries are just now discussing the changing in the international health regulations. The international health regulations are a very good example when a crisis also provides a window of opportunity. The current international health regulation was approved after the SARS crisis, and it made many important changes in the old version. But now we need to move it forward, and this will be a very important debate that you have. About another topic that you mentioned, the intellectual property issues and how can this be a barrier for access, I think that clearly that we need to discuss this kind of thing. It is ironic that if this pandemic was caused by influenza pandemic virus, we could use the pandemic influenza preparedness framework that, for instance, enforces producers to share their production with WHO, to sell a proportion of their production at an affordable price, and to have tech transfer agreements with developing countries. But this can only be applied for influenza pandemic virus. There was a lot of debate when I was in Brazil, in WHA, we always supported to use this as a platform for all threats. So this is the kind of debate that we need really to have if we are seriously talking about it to be better prepared in the case of a new public health emergency that we know will happen. We don't know when, we don't know the severity, but it will happen for sure.
Thank you, Jarbas. And I see how Florence is back with us. So let's see whether her audio works. So Florence, we're talking about the health challenges in the region, and we're talking about your plans. Like, what plans do you have to tackle those health challenges if you're elected the next director of the Pan American Health Organization? So over to you, Florence, and welcome again.
Yes, thank you very much. The first thing, I apologize really for this inconvenience because I'm at my daughter's house and trying to cope, with all the technology that we are having to participate to this meeting. I really apologize. And I didn't catch up, after the first question. Maybe we can talk about it after that. But I will answer the question about the challenges. It seems to me that worldwide, we did an experience. And the first experience that we did is that we didn't as much prepared that we thought, to cope with some pandemic. The second experience is that we find out as well that coordination is key, in this type of challenges. The third experience that we did is that we need to have a stronger solidarity among us, stronger equity, stronger action that can help us being resilient and sustainable in what we are doing. And it seems to me that the last one is really regarding our new approach about health. We find out, and it's the most important things, that we need to consider a One Health big strategy approach, as well as a global health. I said that previously, that for us as a doctor, medical doctor, we learn that, unfortunately, that most of our duties is inside of clinics, which means that you are waiting for patients to be sick, to be seen at our clinics. But over decades, we can say, honestly, it's not that we failed, but we keep doing exactly the same things, expecting that we will have different results. So from my point of view, it is an opportunity, facing these worldwide challenges that I mentioned. Those discrepancies that were increased. It is our duty together to ensure that we can adopt different approaches that can help us having better results. So my point of view, it's first of all to have an approach centered on people. When I'm saying centered on people, it's not only about disease. It's about all the determinants that can influence our health and well-being. By saying that, because I had the opportunity to have some financial costs, I have the opportunity to have some health reform, education in one of the best universities of the world, I can say that. It seems to me that this is an opportunity for myself first to show and to be proud of being at those universities and to apply what I learned. Apply what I learned, not with the spirit of one size fits all, but to use my mindset, to use a group of people that will change. Because we need the word that we need to use. There a need, unfortunately, to make some change, to obtain more result, to have more people that can bring together an approach, these many actions that can be based on what people need. So by saying that, my approach, if I can summarize, is really centered on the client. is an approach holistic, where unfortunately we need to admit it, that it's not only your background in health services or in public health. We need to address some policies. We need to address some politics to ensure that we can go together in a new way to seeing global health, which means by working with economy, by working with education, by working with agriculture, by working in traditional medicine, by working in deep research based on situational analysis of each country, and by working as well with these big things that represent everything today, that can mix together everything, which is the climate change based on animals, medicine, botanical medicine, and to see how we can put everything in order together that can create some bridge to have a better result.
Thank you. Thank you, Florence, for raising the importance of the social determinants of health and the broader concept of health. Jimena, do you want to comment and maybe follow up on the conversation with Florence? Please, over to you.
Thank you, Javier. Thank you, Dr. Guillaume. It's really refreshing to think that a possible candidate to PAHO really considers the reform of our healthcare system in a very holistic, with a very holistic perspective. I really appreciate that. At the same time, addressing social determinants of health, and I will say lately the literature goes into commercial determinants of health, can sound very ambitious for a 5-year term. So my question will go to this end. What exactly would you think will be needed to be prioritized in order to have user patient-centered healthcare system, both creating them nationally in every single country and then regionally? You mentioned that we need a stronger equity, we need a stronger solidarity. That pandemic has showed as well that we cannot rely only on solidarity or donations. The COVAX example, it's again exemplary, showing how we cannot rely on donations of other countries for COVID-19 vaccines, unfortunately. So how do you envision moving forward what will be the first steps for having this kind of holistic view of our healthcare systems? And probably here I will emphasize the need to concentrate our efforts on some specific populations. You have a special role as coming from Haiti, right? One of the countries that probably has been mostly affected by the pandemic. And that gives you a double agent view of the problem of our healthcare system, which is great. So if you have to tackle specific steps moving forward, what will those be?
Pardon me what I'm going to say. When you want to change the world, you start by changing what is inside your family. I think it will be important for me. The advantage that I have the advantage of being a field person in public health. I have also an advantage that not being part of the cuisine, if I can say that, of the PAHO. So, which means I'm coming with all my genuine, mindset. And the best thing to do is to understand what we are doing inside of PAHO. Because PAHO is an important organization. And it's going to be difficult if you are not unify our mindset inside of PAHO. It might be difficult if our governance in PAHO is not a participative governance, creating, that communion of mindset that we need to make change. Because it's going to create another world that we didn't want inside of PAHO, and it can be, unfortunately, not a good thing for all the state members contributing to PAHO. The second aspect of it is to ensure that we have clear objectives. The first objective is, of course, because it's like we must have a two-pronged approach, I will say. The two-pronged approach is doing the reform, but we cannot freeze what PAHO is doing, because there's really most pressing health issues that we need to address within the regions. So we need to see what will be the best strategies, approaches, actions that we need to address the most pressing actions while using them as a platform, to build the new PAHO, if I can say that. The second aspect of it, I know that we have PAHO strategic plan that will be ending in 2025. We need together, to sit down and see honestly what was well done, that we can continue and build upon. And if we need together to modify the strategic plan for the 2 remaining years of the 2020 until 2025, we need to honestly sit down and make adjustments. So for me, this is the second aspect of it. We have also other plans that has been approved by all the community of PAHO and state members. And we need to see, when you talk about sustainable health, what it means, because it's true that there's a plan, there's an agenda, if I can say the exact word. There's an agenda, but we need to be honest that the agenda is beautiful. How can we sit down, create maybe special committees that can work on each chapter of sustainability to help us move forward? Because the mistake that I wish that we are not doing is to go faster without knowing where we are going. So we really need to sit down with all the technical competencies that we have available within PAHO. We have competencies in countries, big, small, I don't know how to call that, island, Caribbean. So put them together, being focused on what links to us, on what unifies us. What is unify us is to have a better American region. This is what we need. So by saying that, we need really to find a way to discuss together honestly without, having a blindness completely. We know if there's something that needs, we know what it is, but we don't know how to put ourselves together to make it happen. So we need to sit down to make it happen. So if we agree of plans that we can have concretely some actions that can be implemented, depending on the level of the countries, it can be tailored, at the end, you can have it, landing within countries to ensure that we do not have the bad rebound effect that we have had in some operation in the past decade. So the third thing is, of course, to work about resilience. And working about resilience means, to me, build on the capacity of some countries that show that they have a quote-unquote capacity of resilience, capacity of human resilience. But it's not the capacity of human resilience means, you can adapt yourself in all environment. That means you are resilient. Resilient means broader than that. In fact, resilience means it's a good companion, of sustainability. Because if you can be resilient by having some health determinants that can create social justice, that can create solidarity, that can create availability, not particularly inside of each country, it will not happen. We don't have to fool ourselves. It will not happen. But if we can have within the region a country that is dedicated, for example, for supply chain, because now I'm managing a global health supply chain project for USAID. So I know exactly what I'm talking about. If we can find a way to ensure that everything that can happen within this region can be available within this region to respond to whatever event, good or bad, that we have in the region, it will be a good source of resilience. So by saying that, resilience must be collective. We need to have a collective resilience. It's not a resilience country by country and expect that it will happen. The country by country will come progressively. But if we can have as a region, a country, a region, resilience to respond to our countries, it will be a good asset and it will be a good plus. We will be succeed together and we will move forward together. So this is, I think, the value that I'm bringing to PAHO. The value that I'm bringing to PAHO is my way to communicate to everyone. It's my way to listen to everyone. And it's my way to ensure that together we can move.
Thank you. Thank you very much, Florence. And that was a perfect segue to focus on PAHO as an institution, the challenges the institution faces. We've heard about, challenges with legitimacy, challenges with financing, challenges with finding its place, in the global health architecture in relation to WHO, in relation to the, multilateral development banks, in relation to pandemic preparedness. And I just wanted to ask, Jarbas, you've been within PAHO for a few years this time around, and you were before with PAHO. You know PAHO, very well. So what's your plan to actually address the challenges the institution faces? And is there, a need for reform? Can you talk a bit about that? Over to you.
Thank you, Javier, for this question. I think that it's very important to recognize that for the last years, PAHO has made a lot of improvements guided by member states. I think that member states in the Americas, they are very active. They participate a lot. They are presenting proposals. And many of these initiatives that are implemented, they improved a lot in terms of accountability and transparency. I think that's important to build on these achievements and to how we can move forward in order to be always more transparent for our member states. Second, we have the problem of financing. PAHO, as you know, is at the same time an independent organization of the Organization of American States system, and is the WHO regional office for the Americas. So PAHO is clearly interested in all the debate about the proper financing for WHO that has been discussed now, and the countries in the world have achieved some agreement, and it's important to improve the proposal and to have this proposal implemented, because if we want better and more efficient regional and global coordination, we need to have proper funds for the organization. And these funds needed to come mainly from the assessed contributions. Because in the case of WHO, the assessed contributions by the countries are only 25% of the total budget. The other 75% coming from earmarking the voluntary contributions. So the real priorities that are established by the governing bodies face this challenge, because the earmarked contributions have represented 75% of the total budget. In PAHO, the situation is different. We have almost 80% of our budget comes from assessed contribution. But we need to increase this assessed contribution. We need to get a fair slice of WHO budget. I also want to recognize that in the last 3 years, the Director General Tedros made a very important effort to increase the portion that comes to the Americas, but we needed to still get more funds from WHO in order to have a fair distribution of these funds. I think that is important also to increase the focus on technical cooperation in the countries. I think that's important to strengthen PAHO's country office in order to respond to the new scenario that we have, the new realities after the pandemic, the new priorities of each country. So to increase the capacity of PAHO to deliver technical cooperation at the country level, I think that is one important topic to be strengthened. The second is to implement concrete measures to promote gender equity in the organization, especially in management positions. So it's very important to give more opportunity, for instance, that in our staff, to give priority for women to participate in training, in workshops, in initiatives that can develop their managerial skills, and at the same time to see concrete initiatives to have a better balanced representation of countries and sub-regions. We have clearly some countries that are not very well represented in terms of PAHO staff, so it's important to give more priority to these countries in internship, in training programs, in order to have a better balanced organization. Third, I think that also is important to support the permanent technical qualification of PAHO's staff and their engagement with the organization. This is crucial. PAHO can only lead the health in the Americas if you can provide the highest technical quality cooperation to the countries in our region. I also want to reinforce and improve prevention and zero tolerance programs against any form of harassment and sexual abuse and exploitation of employees or population served by PAHO. We had that very important incident with WHO in Africa, and I think that is important to be vigilant, to see, to review how we can create internally a respectful workplace, and also to protect in some vulnerable countries that we are working in humanitarian crisis, that PAHO cannot cannot tolerate any kind of harassment or sexual abuse and exploitation. It's important to keep a good coordination with WHO, and as I mentioned, to seek the continued increase in resources for PAHO, to deepen the use of innovations disseminated during the pandemic, such as virtual meetings like this one that we are having now. We don't need to spend 6 months and to spend $300,000 to have a regional meeting. We can increase the participation of the countries of our member states. We can have more regional consultation. We can have more meetings using this new platform that are available. I think that is also important to encourage increasingly active participation of all countries in the governing bodies in the discussion. Some small countries, they comply because they are not present here in Washington with the embassies or with the permanent representation to the OAS. So we also need to use this platform to have them participating in the discussion. And finally, I do believe that the PAHO needs to rethink the resource mobilization strategy in this post-pandemic era, to identify and to work together with new donors, with new partners, to strengthen the network of collaborating centers, academic institutions in our region, in order to have them participating in this effort to achieve real universal coverage and access in our region.
Thank you, Jarbas. What you said on technical qualification of PAHO staff resonates very much. I mean, in the previous event we had, people were talking about how PAHO in certain areas doesn't have, the strong qualifications anymore, and people refer to the American, the U.S. CDC and other agencies. So that part of, really having technical qualification resonates with some comments we've had in the past. Florence, what is your take about, these key institutional challenges that PAHO is currently facing, and what reforms are needed? Over to you, Florence.
Thank you very much, Javier. I will say that we cannot I will start by something negatively. We cannot continue to make the same things and think that we have different results. We must keep this in mind as, our thematic. So whatever could happen, we need to change our paradigm. When I'm saying that transparency is very important. Accountability is important. But when we are talking about those words, often we think about money. I'm sorry to say that when we are talking about accountability only for financial aspect, we are wrong. We are wrong because all of us know that before making budget, what we are making is an action plan. It's strategies. It's approaches, which means that if we have bad approaches, bad strategy with all the things that we do not have, for example, the respect of human rights, the respect of law, if we are making this without having in mind social justice, we are going to have a budget that cannot be implemented according to our will. So transparency for myself start with technical approach. If together we agreed on the technical approaches, on the technical actions that we are going to implement, or that we are going to assist each country to implement, we must have budget according to those technical approaches. And then transparency means, a chain of building trust, of building confidence. We cannot have bad surprise at the end. I'm always say that when the report is out, when we are discovering that things were bad, in implementation, it's already too late because the bad things have already happened. So, which means that we need to have a transparency, left, right, and center, all over our actions that can accumulate, with the implementing of our financial budget and the result that we are obtaining. So this is my first approach. The second approach that we knew is, I'm not too sure that everyone understands. When I'm saying everyone, countryside, PAHO inside, and also our contributors. We cannot ask contributors to change what they are doing by having, really contribution, financial contribution that coming all set already. It's like you cannot move, you do not have the flexibility to use this contribution, this financial contribution, in the spirit of a holistic approach. We need to have, and I think it will take time, but this is the best approach, to meet with our contributors, to present to them, as a private meeting, present to them what we envision. Because even if they are businessmen, even if they are business organization, they want to succeed. They do not want to fail. So we need to ensure that we have a joint understanding of our new approaches and help us, because they are business. They know what it means. Health is an investment. Health is not a benefit. It's an investment that they are making in people. So which means that we need to ensure that our contributors can be aligned with our vision, because technical discussion happen with technical people, and when we need the money, we go to the financial contributor. It cannot continue this way. We are going to, they will continue in their way, we will continue in our way. And the only thing that they will ask us, if I'm going to have, for example, money to treat breast cancer, this is only to treat breast cancer.
But they might see that if we are preventing everything that can cause the increase of breast cancer, it will be an investment, a more productive investment. So we need to discuss with them to ensure that they can understand, to ensure that they can understand that with one stone, we can have a dominoes effect. We can have a result that can be positive for a lot of things. So how can we be bright enough to be strategically broader enough to bring them with us for us to have a better result? So this is the things that I will see in addition. And of course, we need to have human resources, the right person at the right place. Because PAHO is not an organization where we keep adding people without having competencies that we are looking for. So everything happens because you have good human resources. So if we have human resources that cannot cope with what we are saying, I'm sorry, we're still wrong, because it's not an issue of the director only. It's a collective responsibility that we have. So we need to ensure that we have the right people with the right conviction, with the right belief to make it happen.
Thank you, Dr. Florence. That was interesting, and unfortunately we're running out of time. So I'm gonna give you three, just a 1 minute final remark, and we will start with Jimena. So please let us know your main reflections, takeaways, comments for us to reflect on going forward. Jimena, over to you.
Thank you, Javier. It was really interesting and helpful to listen to Dr. Barbosa, Dr. Guillaume about their perspectives of what should PAHO will be going through the next 5 years. And one of the key issues or reflections that I have is it's based on 3 aspects. The first one is that we definitely, and I think we are in consensus here, we definitely need to strengthen our national healthcare systems. We see different means to that end, but basically we're thinking in creating some benchmarks and at the same time having a user-centered approach. Then the second aspect is having a regional coordination, right, and collaboration. And here, something that stands out is that we have to be very cautious to the extent of that coordination so we can prevent this fit-for-all approach. And being more, again, going to the holistic perspective, being more mindful about what specific needs do we need as country, as a region, and how we can collaborate to that end. And the third point is that we have to think harder and about PAHO management and all the challenges around PAHO management. It has been mentioned: funding, technical qualification of the workforce, more representation of the countries. I would add even representation of the civil society organizations of our region who have played an outstanding role during the pandemic. But all these aspects of the PAHO management leads to have an intentional representation of our democratic values. So I think these 3 key issues has been standing out from this dialogue.
Thank you, Jimena. And we run out of time, so maybe one word that you want to basically convey to our audience about what you will be doing if you are elected director of the PAHO. Just one word. Dr. Florence, please, just one word from you, please. How would you summarize your plan in the next 5 years in one word?
Change of paradigm.
Change of paradigm. Okay, that's 3 words. But thank you very much for your participation. Jarbas, what's your word?
Thank you, Javier. I think that in one word is innovation, improvement and efficiency. I think that PAHO can lead this region to change the game, to strengthen national health system, primary health care, and to reduce the totally unacceptable, preventable deaths that we have in this region.
Okay, innovation. Well, thank you very much to our panelists. Thank you to Jimena. Thank you to Jarbas, to Florence. It's been a pleasure to have you on our platform, and thank you to our audience. Please keep watching this space. We'll be following up the election. It's next Wednesday. And of course, this is a platform for you all. So I'll see you very soon. Have a good day.
Thank you very much. I appreciate the discussion. Thank you, Abbas, to be my partner here.
Thank you, Florence. To be a pleasure to participate with you in this. And
thank you,
CGD.
Good luck to you both. Thank you very much for the conversation.
Thank you.